arteries and coronary veins. There's four major coronary arteries that we're going to name, and four major coronary veins. And the function of the coronary arteries and veins is to supply the heart with blood. Now, if that seems, I don't know, illogical in the fact that the heart, in fact, is filled with blood, remember it's a very thick muscle. So simple diffusion is not going to supply the heart with the blood that all the cardiac muscle cells need. So it needs its own sort of independent miniature circulatory system, the coronary circulation, coronary arteries and coronary veins. The two major coronary arteries, which are the right and the left, you see the naming is not very difficult, arise in essence right from, well, you can see one of them is kind of like right here, and the other one is sort of like right over here. The right and left coronary arteries are basically the first vessels that can branch off the aorta. So the pressure in the coronary system is actually quite high. So the highest blood pressure in the systemic circuit is that one, right where they branch off and supply the heart with blood. There's a couple of pictures, of course, which will illustrate this to you. But the coronary arteries branch into several, well, many smaller branches, but only a couple that we're going to deal with. You can see the branches of the right coronary artery. One's called the marginal artery, the other, which is the margin of the heart, and the posterior interventricular artery. Those supply, part of the heart with blood. And then the left coronary artery branches into the circumflex, which kind of goes around, and the anterior interventricular artery. These are often the ones, or these are the ones in essence, that bypass surgeries deal with. So if one of these arteries becomes clogged with plaque or just buildup of fatty material or something like that from the diet, we've all seen these pictures that I mentioned the other night. This is where these bypass surgeries are done. Sometimes they'll put in like a little stent, or they can go in and maybe clean the artery out. But sometimes it's like, you know what, there's no way, we just have to bypass it. And if we don't, the heart muscle is going to die, and that's a heart attack. Of course, that can be fatal. So these are the coronary arteries. But remember, anytime there are arteries, there are always veins, because the veins, sort of collect the used quote-unquote blood and return it, back into circulation for reprocessing, so to speak. So those are the major coronary arteries to think about. The coronary veins, there's only four that we're going to look at here. You can see that it's not a very imaginative naming situation here. The great, middle, posterior, and small cardiac veins. The enders are small, of course, but these veins sort of shadow the arteries and penetrate the same tissue that the arteries do and collect the deoxygenated blood that the heart is used to take back into venous circulation. There's also that structure I showed you on the back of the heart. I'll show you again. It's this sort of enlarged area. It's right by the hole back here. Of course, this hole is where the stick goes in. Don't think that's a structure. Anyway, this is hole, but this sort of enlarged area back here is the coronary sinus. So the coronary veins, the four you see up there, sort of all like a river. They all sort of drain into a main sort of sac back here called the coronary sinus, which collects that blood and then dumps it into the right atrium. So I suppose you could say there are three sort of major tributaries bringing deoxygenated blood into the right atrium. We have the superior vena cava, the inferior vena cava, and also the coronary sinus. So the three major sort of tributaries bringing blood back into this structure. Hey, these are just some pictures that show where they're located. This picture right out of your book. So you can see the right and left branch right into the base of the aorta. So very high pressure in the system here, and they supply the muscle with blood. And here's the picture from the back. The thing to notice on this picture again is the position of this structure of the coronary sinus, which is going to empty blood back into the right atrium. I thought I had a picture, but I guess I don't. Yeah, I think it's at the end. I'm not gonna. I don't go into. You get to some physiology. I don't think we need to go into all the stuff about the, systolic and diastolic cycles, the atrial and the ventricular cycles. That's just the cycle, that's what that you listen to, through a stethoscope, the heart sounds. I think the most impressive thing about this whole cardiac cycle, the filling and the emptying, is if you look up here, this is the start of the cycle. The atria fill, the ventricles fill, the ventricles collapse on themselves, they pump, and then the whole cycle starts over again. And the total time involved is less than 1 second. It's 800 milliseconds, and that is really impressive, considering that also you can also bump up your heart rate much higher than that. So the whole filling cycle, less than 1 second. You can see the actual breakdown of the time on this little clock face here, that we're not going to worry about that. So anyway, this is the sequence of events, and you get a lot more about this in physiology, and of course in nursing schools they really are, of course, are going to drill this into you, that's for sure. And probably the last thing, and I'm going to come back to this slide, but probably the last thing, the last major topic that we need to discuss in this unit about the heart is how the heart beats. How does it actually, where do the action potentials come from? Well, they actually come from 2 places. One, of course, there's centers in the brain which regulate our heart rate, but the heart has its own independent pacemaker, which I think is pretty impressive. So you've seen these things where they do heart transplants. Well, they stop the heart, and then they sew it up, they put it back in there, they stitch everything together, make sure there's no leaks in the plumbing, and then they shock it back to life. Well, the heart has its own intrinsic pacemaker, and it's this structure right here. It's called the SA node, the sinoatrial node. You can see it's right up here, kind of in the top, almost kind of where the superior vena cava comes in. There are cells, pacemaker cells, located in this thing called the sinoatrial node, and I'll come back to that first slide in just a second, but they generate somewhere between 80 and 100, I think that's usually the number, action potentials per minute. In other words, they're the cardiac pacemaker. And these action potentials spread across the atria through these little things called internodal pathways to another group of cells which distribute the action potential. And these are sort of right here at the base of the auricle, kind of the top of the atria here, or the ventricle, I'm sorry. And this is called the AV node, atrioventricular node. So the action potential starts